thank you, everyone, for being here. You know, as polarized as the American people are, they are unbelievably united in their support for Social Security and Medicare. When the Republicans, just after the election, announced that they were going to dismantle this program, end it as we know it, all of these groups were able to collect over 1 million signatures on petitions almost instantaneously. And we plan after this press conference to be delivering them to Speaker Ryan and to Leader McConnell. So Medicare is a program that the Democrats established, and we are very fortunate to have with us today champions, Democratic champions in the Senate and the House who are here to make sure that they are fighting for us to make sure that Medicare will be here. These are earned benefits, and we want them. So we have a number of speakers who are able to be with us today, and we are going to start with Leader Pelosi.
Thank you, Nancy. Thank you, Nancy. Good morning, everyone. Thank you for being here to protect a great pillar of economic and health security for the American people, all of the American people. America's seniors are central to our family life. I'm glad that we'll be with Chuck Schumer and Bernie Sanders, Tony Cardenas from the House, Jan Schakowsky, Ted Deutsch, with so many very special guests, Nancy Altman, Rick Fiesta, Karine Jean-Pierre, Jean Ross, and Max Richmond. So that's the program, maybe more. But I'm here to speak on behalf of the House Democrats because we see close up and personal the actions of the Republicans in the House to turn their dream of ending Medicare into a nightmare for the American people. And when they do so, they say, well, it's not going to cost the current seniors anything. No, current seniors will pay more with their budget and their plans for the Affordable Care Act to open up again the donut hole, to take hundreds of billions of dollars out of Medicaid, which is about long-term health care for our seniors. And the list goes on. Destroying Medicare and making seniors pay more is not what the American people voted for in the November election. Democrats will protect Medicare with all of our strength, just as we did in 2005 and 2006 when President Bush wanted to privatize Social Security, another pillar of economic stability for our country. Today, we will deliver a stern message to Republicans in Congress. We will not stand by while Republicans dismantle the promise of healthy and dignified retirement for working people in our country. As Nancy said, this is something they have paid into. We are going to mobilize, expose, and defeat Republicans' deeply damaging scheme to end Medicare. Republicans don't understand, but Democrats in Congress do, and millions of Americans across the country are going to make it very clear. Hands off Medicare. With that, I'm pleased to yield back to, who's next? Nancy. Hands off Medicare. Hands off Medicare.
Hands off Medicare. Hands off Medicare. Hands off Medicare.
The next champion, Senator Bernie Sanders, knows that what we want to do is that we want to expand Medicare, not cut it and not dismantle it, that this proposal that the Republicans are putting forth is moving us in the wrong direction.
Thank you. Let me begin with a quote made by a Republican candidate for president, a candidate who reached out to working people and who reached out to senior citizens. And during the campaign, this is what that Republican candidate said. He said, I am not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Every other Republican is going to cut them, end of quote. Mr. Trump, we are going to hold you accountable. You told the seniors of this country you were on their side. You told working people you were on their side. You said you would not cut Social Security. You would not cut Medicare. You would not cut Medicaid. You know what? Millions of us are going to demand that you keep your promise. And we're going to tell the Republican leadership in the House, we're going to tell the Republican leadership in the Senate, forget about all of your plans to voucherize Medicare, to raise the retirement age for Social Security, to slash Medicaid. It ain't going to happen. And what we are going to do are rally millions and millions of working people for whom Social Security, Medicare, and Medicaid is life and death. Let us be very clear. We live in a nation which has more income and wealth inequality than any other major country on earth. We live in a nation where 43 million people are living in poverty. We live in a nation, believe it or not, where half of older workers between 55 and 64 have nothing in the bank. And we are not going to allow the billionaire class or Trump or anybody else to cut the programs that the elderly, the disabled vets absolutely depend upon. As Nancy said, we understand that millions of seniors cannot make it on $10,000, $11,000, $12,000 a year Social Security. Our job is to expand Social Security, not cut it. And we understand that despite Medicare today, millions of seniors still struggle with health care bills. Our job is to improve Medicare, not to cut it. Now, on all of these issues, it's not just us who believe that we've got to protect these vitally important programs. Every poll out there says that the American people are with us. And that is why the leadership of the Republican Party in the House and the Senate and Mr. Trump have got to start listening to the American people, not the drug companies, not the insurance companies, not the billionaire class. If we stand together and fight back, we are going to win this, and that is exactly what we have to do. Thank you.
Well, thank you. First, I want to thank my friend and colleague and fellow James Madison High School of Brooklyn, New York graduate. Bernie was on the track team, and they won the city championship. I was on the basketball team. We weren't that good. Our motto was, we may be small, but we're slow. In any case, it's great to be here with Senator Sanders, Leader Pelosi, Ms. Altman, Social Security Works, and so many others for this important, important fight. Because we're going to need everyone, to stand together next year to fight back any attempt to privatize or weaken Medicare. And my friends, all signs suggest a fight is coming. I know. During the campaign, President-elect Trump promised to save Medicare, Medicaid, and Social Security. He even made it explicit that he disagreed with most Republicans in his party on these Social Security safety net programs. He even criticized them for their position. That was then, this is now. Over the last couple of weeks, Republicans here in Washington are already threatening to privatize Medicare. That's no surprise. It's been part of Speaker Ryan's budget for years. But the president-elect has been silent. Worse, President-elect Trump nominated one of the most avowed enemies of Medicare in the country to be Secretary of HHS, and he's going to get some heck of a hearing when he comes before us in the Senate. When it comes to issues like Medicare, the Affordable Care Act, Planned Parenthood, Rep. Price, and the average American couldn't be further apart. These petitions, right here and here, are proof of that. Between this nomination and Republicans here in Washington threatening to privatize Medicare, raise the Medicare age, repeal Obamacare. It's now clear Republicans here in Washington are gearing up for a war on seniors, and they shall not, they must not prevail. And they start with a full-scale assault on health care programs that serve tens of millions of Americans. Every senior and every one of their children in America should hear this loudly and clearly. Democrats will not let them win this fight. I say to my Republican colleagues, turn back, because we will fight you on this tooth and nail. We will win, you will lose. Turn back before it's too late. Because just as in 2004, I was there, in 2005, where they tried to take out the rug, pull out the rug from seniors and privatize Social Security, they lost. They didn't learn their lesson. They're now trying to do the same thing with Medicare, privatize it, raise the age after people have struggled and worked so hard their whole lives. The policies they propose will hurt millions of seniors. It'll slash their benefits. It'll make it harder to see a doctor, get the prescription or treatment they need, and they'll have to pay more for it. Dr. Price seems to say we ought to let doctors run the whole show because he's a doctor. So there are some good doctors and there are some not such good doctors. We've all seen both. And too many doctors and other healthcare providers without some oversight will charge every senior as much as they can. That's what privatization means. Let your doctor charge you whatever he or she wants. We don't want that to happen. So, we're going to show the American people in broad daylight that the President-elect's promises to working Americans, to seniors and retirees will not prevail. The President's actions will not prevail. We're going to hold him to his words, and if President-elect Trump supports and Republicans in the House and Senate move forward with plans to privatize or cut Medicare, they're in for the fight of their lives. This group today is a show of solidarity, a show of strength. We tell every senior in America we will stand shoulder to shoulder with you to protect Medicare at all costs. Thank you.
And now another champion, Representative Schakowsky of Illinois has been fighting for seniors her entire career, and she's here to talk about Medicare.
Thank you. Thank you. Thank you. Yes, I'm Congresswoman Jan Schakowsky of the 9th District of Illinois, and a co-chair of the Seniors Task Force of the House Democratic Caucus, and we are geared up for this fight. I love this. 1 million, more than 1 million petitions and signatures of Americans. And you know what? It is just a tiny fraction of those in the country who believe the same thing. Hands off our Medicare. 55 million Americans, that includes the elderly and people with disabilities, benefit from Medicare. And 10,000 people, Americans, every day are turning 65. And add in their families who count on their elderly relatives and people with disabilities to get these benefits. And so this is a vastly popular program, and people are not going to stand by. I don't care if it's Republicans or Democrats or the Freedom Caucus or the Tea Party or independents. Whoever it is, they're going to be joining in this fight. Our inside-outside strategy is going to be very important, and that's what's represented by these petitions and all of the mobilization that's going to be happening with senior citizens and all people around this country. So here's what Donald Trump said, to quote, I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare and Medicaid. And he said, every Republican wants to do a big number on Social Security. They want to do it on Medicare. They want to do it on Medicaid, and we can't do that. Those are direct quotes from Donald Trump. And yet, as been mentioned, he has appointed two people, or he is dealing with two people, two Republican leaders, who absolutely have the reverse view. Paul Ryan and his health care plan, he calls it a better way, and we call it a bitter day for senior citizens and for people with disabilities. He wants to privatize, essentially privatize Medicare. And then, of course, there is Tom Price, who has been this ardent opponent all this time of Medicare. He's an anti-Medicare and Medicaid person. That's his agenda, and now has been recommended for HHS. And I'm so happy to hear that he's going to have the confirmation hearing of a lifetime to explain how he's going to support his new president and protect those programs. And finally, I want to say this is a winning issue, not just for Democrats, but for Americans. We do all remember 2004 when George Bush was reelected, he made a pledge to privatize Social Security. The rest of the country said absolutely not. We won that battle, and by the way, Democrats also won the election next time out. I think this is the kind of battle that will mobilize people all over this country. It is a battle we can win. Thank you to the groups that made the point early on. This is a winner. Thank you.
Our next champion also understands the importance. Representative Ted Deutsch from Florida.
Thank you very much. Thanks. Good morning, everyone. It's great to be with you. I'd like to thank the great folks from Social Security Works for bringing us together this morning. It's really terrific to be with so many friends who are dedicated to fighting for our seniors, the Alliance for Retired Americans, Move On, National Nurses United, the National Committee, and so many great Senate and House Democratic leaders and champions for our seniors who are ready to fight for a secure retirement for all Americans. Now, we know that Medicare is a foundation of a secure retirement for hardworking Americans. That's because it provides real and comprehensive coverage. And we're not going to let Republicans turn it into a voucher. We're not going to let them pull off this bait and switch on the American people. We will make it crystal clear. Keep your hands off our Medicare. You know, 2016 was full of surprises, no doubt about that. But those surprises have not caught us flat-footed because we've been fighting this battle for a long time. Donald Trump will be new to Washington, and he'll be new to this fight. So it's our job to be sure that the president-elect hears from us early and often. We will give him the opportunity to join us on the winning side of this fight. Give him the opportunity to reject the dangerous, cruel policies of Ryan and McConnell. And we will not compromise the health, safety, and security of retirement in America. Donald Trump made promises during this campaign. He promised that he won't cut Medicare or Social Security. Now it's time for us to leave those promises ringing in his ears. No one knows, let's be clear, no one knows the value of Donald Trump's words. We don't know which promises he will keep, but we know that we will fight tooth and nail to keep our promises to American seniors. We're not going to let Paul Ryan and Mitch McConnell twist the outcome of this election into a call for dismantling Medicare and Social Security. This election wasn't a mandate to destroy Medicare. Americans aren't demanding higher prices for medicine. Americans don't want to leave seniors hanging out to dry when they get sick. And we are going to be sure that Paul Ryan, Mitch McConnell, and President-elect Trump are not able to conjure up a mandate out of thin air. Now, finally, you know, I'm not sure how many of you follow Ann Coulter on Twitter. And you may not know this, but she and I graduated from the same school. And in the past, it has been the only thing that we've ever had in common. But now it seems there is something else. She tweeted that Medicare is not what the election was fought over. So finally, there is something else that we agree on. It's time for us to buckle in and double down on our promises to seniors. We will not give up this fight. We will not turn our backs on seniors. We will preserve and protect Medicare and Social Security for generations to come, and I am thrilled that so many of you are here to help us do it together. Thank you very much.
And one more fierce champion, Representative Cardenas from California.
Thank you very much. I genuinely hate when people go hungry, when people don't have a place to live, when people get cheated out of things they've worked hard for and earned. Some seniors have health issues after a lifetime of back-breaking work. Medicare is something that's there because you've worked hard for it, and you've earned it. It's the same thing over and over. Republicans snuggle up to seniors during campaign season, and now here we are. They're back in Congress, ladies and gentlemen, and we're going to have a new president, and they want to gut Medicare and end Social Security. I want to thank all of the seniors who signed these million-plus petitions. But the work's not done for us in Congress and for you out there in the streets in America. Go to your grandchild, get online, and make sure your neighbors, you can get other people to sign those petitions as well. Because we're going to get to 2 million and 10 million and 30 million. That same grandchild hopefully can help you get on that computer and navigate through this. But let me tell you this, let me leave you with this truth. That same grandchild who asks your son or daughter, Mommy, Daddy, why do you give Grandma that money? I see you do that. No person wants to go through life and then see their precious loved ones have to do that for them. Because without that support, they're going to do without. Yes, ladies and gentlemen, people starve. Yes, ladies and gentlemen, there are people who work their entire lives and are in dire pain, and they can't get the medication they've earned and deserve to live a life of dignity. Let's come full circle, ladies and gentlemen. Let's embrace each other. Let's know that we are Americans, and this is the United States of America. And dignity and a life of dignity until somebody leaves this earth is deserved and earned. And that's what makes us Americans. We are compassionate. We love and respect our neighbors and strangers. And that's not what the Republicans want for our seniors today. In just one election and in one Congress, they want to take that away from all of us. This is about dignity, ladies and gentlemen. It's about people we love. They deserve better. And we are going to fight together in Congress and on the streets of America to make sure that we all understand we cannot put up with that. We are the United States of America. We do not starve our seniors. We do not insist that they live in pain because of things that were done in Congress. They've earned the right to have a dignified life, and that's what is under attack. Thank you very much.
Thank you to all the members. We have several outside groups who are going to speak very quickly, leaders that helped collect these petitions. We're going to have one first, then open it up to some questions because some of the members have to leave, and then we'll go with the other questions, the other speakers as well. So we'll start with Rich Fiesta for the Alliance for Retired Americans.
Thank you, Nancy. Thank you. I'm Rich Fiesta with the Alliance for Retired Americans. We're a nationwide grassroots advocacy organization for retirees. A year ago, we were here celebrating the 50th anniversary of Medicare and the great things it had done. And today, we're here to preserve, protect, and defend Medicare for the next 50 years against this onslaught of attacks we've had in just the last 2 weeks. Medicare benefits, as we've heard, have been earned after decades of work, and we are not going to stand by while someone tries to come and dismantle. Our members are irate. Many issues, as we heard, were discussed in this campaign this year, but Medicare voucherization, privatization was not one of them. Despite this, people like Paul Ryan and Tom Price now act as if they have a mandate to privatize and voucherize Medicare. And we especially want to say to the gentleman from Georgia, the price isn't right. The price isn't right. Medicare privatization is wrong for today's retirees and everyone else who works and expects a lifetime of a dignified retirement after that work, which includes Medicare and Social Security. This morning, we're contributing from the Alliance for Retired Americans more than 250,000 of these signatures. Our members are out in the streets right now, this week and next week. We've scheduled more than 100 meetings with members of Congress in their states and districts, and we'll double that by January as well. So we are energized and mobilized to fight this fight that just a year ago we were celebrating the great virtues that Medicare has had for nearly 50 million Americans. Thank you.
And now, if there are questions for the members, we can have questions and then go on to the other speakers on this subject, only on Medicare.
To Senator Schumer, you claimed just now that privatization of Medicare would mean your doctor gets to charge you whatever he wants. That's not my understanding. Privatization of Medicare would mean that they would cut a deal with the insurance companies. Your comments almost seem to minimize the role that the insurance companies, which have backed you along with other sectors of finance, you can take money from the nominee for the Treasury Secretary, Goldman Sachs, Citibank, and so on. Can you defend that remark?
Yes, absolutely. I can absolutely defend it. First of all, of course, it lets the insurance companies do what they want, but it also lets individual doctors do what they want, and they're going to tell they and the insurance companies together will get together and decide the price. Right now, Medicare, no, I'm going to answer your question now, please, sir. Medicare, right now, sets limits on prices because it's government run. Privatization means the private sector, both the insurance companies and the doctors, set the price without regard with what the patients can afford. Okay, yes, go ahead. Next question.
And you should say your affiliation, too. I'm sorry, what was your affiliation?
San Hussein, an independent journalist.
Are there Medicare reforms that Democrats would like to see occur in the next Congress?
Well, sure. We want to see Medicare strengthened. We want to see Medicare improved. We want to see it cover greater. There's too much in terms of deductibles now. There's too much in terms of copays now. And lots of people on Medicare are forced to either buy extra insurance or not get, coverage for things they need. We'd like to expand Medicare, not shrink it, not privatize it.
And if I could add to it, in this country, we pay by far the highest prices in the world for prescription drugs. And to quote Donald Trump again, during the campaign, he said, wouldn't it be a good idea if Medicare negotiated prices with the pharmaceutical industry? We're going to hold them accountable for that. And I live 50 miles away from Canada. Many of the same prescription drugs are sold for 50% of the price. We are going to bring forth re-importation. Trump mentioned that. So to pick up on Senator Schumer's point, we want to expand Social Security. We want to take on the pharmaceutical industry whose greed is hurting millions of Americans, lower the cost of prescription drugs.
One more, and then we will go to the other speakers. Yes.
Go ahead.
That's a very good question. The question is, who's going to pay for it? Right now, top 0.1% has almost as much wealth as the bottom 90%. In the last 16 years, we have seen a tenfold increase in the number of billionaires in America. Today, despite Americans working longer hours for lower wages, 52% of all new income goes to the top 1%. Have I kind of answered your question? The people who are going to pay for an expansion of Medicaid is lifting the cap on taxable income, all right? And when you do that, you do two things. We can extend the life of Social Security and Medicare, and we could also expand the program. So in the midst of massive income and wealth inequality, of course, the top 1% is going to have to start paying their fair share.
I'd also just like to remind you, Social Security came to life in the middle of the Great Depression. Here we are today, not only the richest country in the world, but the richest moment in history. So how dare we, as Americans, say, how can we afford a dignified, actually, you know, Social Security is so modest right now, we should be expanding Social Security. We can afford to do that. Senior citizens can't use Medicare for hearing aids, for glasses, for dental work, things that they need. There are so many ways that we could help our seniors, and we can certainly afford it as the richest country ever in the world.
I'd like to make a further point. Since the implementation of the Affordable Care Act, the cost of health care in America has reached the lowest rate of increase in over 50 years that they have been measuring that increase. The more benefits we give people, the healthier they are, the lower the cost. Prevention, early intervention, and with Medicare, the intervention they want to have with the Affordable Care Act is to remove the free early examination for seniors. What they want to do is open the donut hole so seniors pay more. So this is about lowering cost by improving the quality of access to health care and the quality of the health care. It's not just about health care in America, it's about the good health of America. Prevention, early intervention, and the rest. So it's a false economy to say if seniors pay more, it's going to cost less to the federal taxpayer. It isn't. It isn't. But again, none of this is possible without the outside mobilization in this fight. We can maneuver all we can, inside maneuvering, outside mobilization. The voice of the people. The people have paid into these systems. They should get their money back. And I might add, with what they want to do through the Affordable Care Act and what they want to do in the Ryan budget on Medicaid, $1 trillion over 10 years taken out of Medicaid. 2/3 of that goes to long-term health care for our seniors. They won't be able to go to their own doctor if you take this away. So all of this is connected. All of this is connected. This is an assault on the stability of health for seniors in our country, an all-out assault. And the American people have to respond to it in the most positive way. They responded to the Republican misrepresentations during the Affordable Care Act, total misrepresentations about it. And I'll say what they are. They said you took $800 billion out of Medicare to pay for the Affordable Care Act. They repeated it over and over. It was a total lie. The savings that came from Medicare were there to prolong, in the Affordable Care Act, to prolong the life of Medicare, to close the donut hole, to provide more benefits, including the early free examination. And that early intervention made people healthier and saved money in the long run. So we have to assert the truth. They were misled by the misrepresentations before. They have to be part of a giving testimony to the truth. This is a fight about the character of America and how we respect not only our seniors, but their families. And if you're 75, 78 years old, you might have a child approaching 55 years old. So this is about your family. This is unfortunate. We wish the fight would go away and they would just face the facts instead of instituting an ideological right-wing agenda that is called the Ryan budget, that is embraced by Price, and to make matters worse, to privatize Social Security. Understand what is risk. Be prepared for the fight. Thank you to the outside groups for their mobilization. Hands off Medicare, Social Security, Medicaid, and the rest.
So, in summary, the three of us, the six of us, we know what they're trying to do. It's a war on seniors, on Medicare, on Social Security, on ACA. With the help of millions of people, both seniors and others around this country, we will win the war. They will not be able to succeed in their war on seniors.
Thank you for those who are able to stay. We're going to have a few just very quick statements, and then we will be delivering more questions if people have questions, and we will be delivering the over 1 million petition signatures. So next, from MoveOn.org, we have Corrine.
Thank you so much. Thank you so much. I'm here on behalf, I'm here on behalf of millions of MoveOn members across the country, including the 80,000 members who signed a petition to protect Medicare and demand no privatization and no cuts. Republicans have no mandate. Let's be clear here. Republicans have no mandate. Having lost the popular vote, the country is not with them on this. Republicans clearly intend to try to take away health care from tens of millions of Americans. Between Medicare, Medicaid, and Obamacare, they want to endanger the health insurance that 1 in 3 Americans rely on today, and that every American will benefit from in their lifetimes. Republicans in Congress needs to keep their hands off our Medicare. Thank you.
Good morning. My name is Sandra Falwell. I'm Vice President of National Nurses United, the largest organization of registered nurses in the United States with 185,000 members. The Nurses of America have a message for Senator Ryan today. We must protect, improve, and expand Medicare. And to U.S. House Speaker Paul Ryan, from voted the most trusted profession in America, we say, hands off Medicare. We urge President-elect Trump not to join in Speaker Ryan's destructive, divisive drive to destroy Medicare. Rather than destroy Medicare as we know it, threatening the health of my patients, let's improve it by enabling it to negotiate prescription drug prices. Rather than waste tax dollars by subsidized profit-making health insurance corporations, let's cover everybody through the efficient Medicare system. 58% of Americans support Medicare for all. We must stop the looming patient care crisis of restricted access to care overseen by insurance company bureaucrats, limited choices of doctors, runaway prescription drug costs, and huge out-of-pocket expenses for families. Nurses never give up on our patients, we never give up on our country, and we stand with seniors, millennials, and people of all ages as we protect Medicare.
Good morning, everybody. I'm Max Richmond with the National Committee to Preserve Social Security and Medicare. I am the last speaker. Thank you, our volunteers. Thank you very much. Everything that's been said about the dangers facing Medicare has been said already, and said very forcefully by our champions in the Congress, by our progressive allies. I don't have much to add except to remind everyone that this war on Medicare is nothing new. But the challenge we face is more daunting than ever before with this Senate, with this House, with this White House. And it's not just about seniors. It's about younger people. It's about workers. It's about the disabled. It's about families that care about the cost of a nursing home, the cost of home care. So in the coming months, we're going to hear a lot. We're going to be bombarded with a lot of false information that Medicare is bankrupt. We're going to hear, and we have heard from President-elect Trump, Medicare needs to be modernized. Now, modernizing is good if you're remodeling a kitchen or you're remodeling a bathroom. Modernizing is not good when you talk about Medicare. It means privatize. We are going to hear about vouchers. We're going to hear about premium support. I call it coupon care. But the real message that we're going to have to understand, the real message that is going to be coming at us to seniors and their families is you're going to be on your own, and good luck. And I'm not even sure about the good luck part, frankly. So we had our activists, our great volunteers, bring a few things. Senator Schumer said that if those that wanted to dismantle Medicare face him, they're going to have a real battle on their hands. He said, make my day. So I want all of you to have these for the knockout punch. Thank you all very much.
You remind that I should make this further point, and I especially want to address it to the question about cost. Remember I said that the seniors fell for the, I don't know, just the Republicans misrepresented with such firmness that people accepted what they had to say. That we took $800 billion out of Affordable Care Act out of Medicare to pay for the Affordable Care Act. That was a total falsehood. But we used the savings to prolong the life of Medicare and to close the donut hole and provide more benefits for seniors. What I failed to say before is the Republicans recognized that those savings were there. And you know what they did with them? They took the same savings that we reinvested into Medicare, and they gave a tax break for the wealthiest people in America, a tax cut for the high end in the Ryan budget. So they're using Medicare as an ATM machine to give more tax breaks to the high end. And it's very important to understand that dynamic. Medicare is synonymous with guarantee. You take away the guarantee, no Medicare, no matter how they want to characterize it. Medicare, guarantee. No guarantee, no Medicare. And that is the fight that we are in.
If there are more questions, now is the time for more questions. Yes.
Well, we are waiting to see what it is. It was filed last night, and we're diagnosing what is in there. We're disappointed about some things that are not in there because they have, it's almost a cowardly CR. But nonetheless, we'll take a look and see, as long as it does no harm. No. I think that our chairman in the Foreign Armed Services Committee, the Republican chairman, and our ranking member, Adam Smith, did a good job in protecting the prerogatives of the House on it. It's a compromise, but I can go into detail on it with you, but it's a compromise that they have a comfort level with. And Adam Smith is our leader on that subject, and he accepts what they are putting forth. So that I don't think will be an obstacle. Maybe for some. My friends, the overriding principle since the revolution of our country has been the civilian control of the military. Only in recent history was that diverted from, was in 1950 when George Marshall was granted a waiver to serve as the Secretary of Defense, even though he had not been out of the military for 7 years. The law says in order to serve, you have to be out of the military for 7 years. A president-elect is requesting that waiver for General Mattis, and the way that it has been shaped is, I think, careful in terms of, left to, under any other circumstance, we'd say, no, you have to have civilian control of the military. This is not General Marshall. But compared to some of the other people he could put forth, you have to make a judgment.
with all due respect, keep it to Medicare, but are there any more Medicare questions?
National President of the American Medical Student Association. I'm just wondering, how do you foresee Medicare cuts affecting the issue of physician shortage in our country as graduate medical education is often funded by Medicare?
You cannot separate the conversation of Medicare from the Affordable Care Act and what they want to do to the Affordable Care Act, because so much of what we have in the Affordable Care Act, and we certainly would have wanted more, is about medical education, to have enough primary care docs to go around, to be available, and to help support the education of those doctors. So Medicare, what they're doing in the Affordable Care Act is very damaging to delivery of service for Medicare and Medicaid in our country. And again, this is part of their agenda. It's part of their agenda, and it's a part of the Price agenda. Chairman Price voted 3 times to remove the Medicare guarantee, probably 64 times to overturn the Affordable Care Act, maybe more, and again has been supported the privatization of Social Security. So there's a great deal at risk here, and they're all connected, but it has a direct relationship to what you're talking about when you see them together. Thank you.
All right. Thank you. And if there are no more questions, one more.
This is a powerful political issue, in addition to a powerful policy issue. I think Medicaid is misunderstood as the most important funding source for long-term care in this country. So people who want to think that Medicaid is only a program to cover poor people, I think they're going to hear a lot about that it's much broader. That's a good thing, helping the poor, but it's also the largest single chunk is for long-term care, both in institutions and also in at-home care. So I think the tip of the spear is really Medicare, because it is ubiquitous and so many families and Americans really get it. But I think that this really is a fight not only for Medicare, but for health care, for older Americans, for all Americans, and it's going to be very, very hard to cut these programs. And let's remember that in my state alone, if Medicaid expansion were removed, that's 1 million more people who would not have health care. So we're talking about 20 million Americans across the country who have benefited from the Medicaid expansion. Very hard to do these things, to actually do these things. You know, when there was a veto pen in the White House, it was easy to talk about, and they voted 60-some times to repeal the Affordable Care Act. Every time a new class came in, they wanted to make sure that the freshmen could also vote a few times to repeal the Affordable Care Act. Now that they're actually able to execute, and that's execute the Affordable Care Act, I think it's a new day. And the advocacy that's out there, this inside-outside strategy that we're witnessing today, is going to be, I think, a tsunami of public pressure to end this war on seniors.
Hi, my name is Sanjeev Sriram. I just wanted to follow up on the question regarding Medicaid and the political support that Medicare has and whether that can be transferred or whether that can be shared with Medicaid. And as a physician who has taken care of low-income families ever since I started my career almost 10 years ago, I can tell you that Medicaid is probably one of the most underappreciated programs in American healthcare. It is, when you look at the most recent recession, Medicaid did the job of keeping our child uninsurance rate decreasing. When everybody else was losing their health insurance, Medicaid was giving health insurance to millions of American children. There are 45 million kids who are depending on Medicaid. Medicaid is the lifeboat from cradle to grave, quite literally. It is covering over half of America's births right now. It is covering 60% of American long-term care for our aging seniors, and everywhere in between. You name one crisis that comes to any state, any part of this country, and Medicaid has been part of the rescue system. And that is what is at risk when proposals like block grants come along, that Medicaid will lose its ability to come to the rescue of Americans when they need that help the most. Next summer, when Zika returns, if a hurricane hits, if our economy ever takes another dive like it did before, it's going to be much harder for Medicaid to do that critical rescue work if we let it go to things like block grants. So my hope as a physician is that Medicaid does not become the bargaining chip in the war to protect Medicare.
And now you've heard the statements, and now we're going to have Bowser from Shana Na and what we call Dr. America to hand deliver these petitions to Paul Ryan and Mitch McConnell, and we urge everyone here who supports Medicare and wants to go with them, join in. Thank you.